Researchers are still learning a lot about COVID-19. Remember, we used to call it the novel coronavirus. Thus far, medical attention is focused on damage to the lungs, but now there's an early study out of Mount Sinai that suggests the disease is actually disrupting the way our blood flows. As News 4's Chris Glorioso explains, that could have a major impact on how doctors battle the virus.
If you x-ray a healthy person's lungs, they should be mostly black, indicating they're filled with air. But look at a COVID patient's lungs. See all that glassy white? That is damage from the virus fluid buildup that stiffens the lung walls, and that means oxygen has trouble getting through. In the medical books, it's a condition called ARDS, acute respiratory distress syndrome. That is definitely happening with a lot of COVID patients, but a new study out of Mount Sinai suggests something else might be happening too.
Physicians have noticed that the rates of clotting is astronomically high.
Dr. Hooman Poor is director of pulmonary vascular disease at Mount Sinai. He recently published this study of 5 critically ill COVID patients. It found they actually had well-preserved lung mechanics, but markedly abnormal blood coagulation. In other words, blood clots were causing blockages.
When they're undergoing dialysis, they're clotting off their catheters. Sometimes we're seeing it in their heart. So clotting seems to be a major feature of this disorder.
In fact, doctors across the globe are seeing severe clotting all across COVID patients' bodies. They're seeing clots in patients' legs, around their kidneys, even in their brains, otherwise known as stroke.
After Broadway actor Nick Cordero contracted COVID, his wife reported on social media that severe clotting required doctors to amputate his leg. Researchers at MIT found more than 70% of the people killed by COVID in their study had clots blocking small blood vessels, and a Chinese study had similar findings.
It is the clots all over the body.
It's extremely important to figure out whether clotting is playing a major role in this process because we have therapies to prevent clotting.
Dr. Poor suspects tiny blood clots all across patients' lungs could be the cause of much of the organ failure we're seeing in COVID patients. And if that's true, it might suggest using more clot-busting drugs or blood thinners to improve outcomes.
The question is, if we administer this medicine or these therapies in appropriate patients earlier, would that lead to better outcomes, and those better outcomes being survival.
Although blood thinners and clot busters have shown some promise in treating COVID patients, Dr. Poor stresses this theory needs more investigation because these drugs can do more damage than good. Mount Sinai and other medical institutions across the globe already working on trials to try to give us the answers. Chris Glorioso, News 4 New York.